My second presentation, the third of our sequence of 4, is the question of loss and grief under the conditions of the corona pandemic. How do grieving relatives feel about their needs for pastoral or psychological support? For those of you who are familiar with palliative care, you know that palliative care is not only for those who are themselves patients, but also the relatives are to be considered as people who need care. And actually, we wanted to survey people who are ready to inform us, to tell us how they felt and how they felt cared for when they had the experience of bereavement that one of their beloved ones had passed away during the corona pandemic, not necessarily due to the corona pandemic, but well, passed away in that time. Due to the COVID-19 pandemic from March 2020, contact restrictions were imposed in many countries, so also in Germany, that made assisting dying family members impossible. Even after their death, many relatives could not see the remains of their beloved ones for a last time or even for a last farewell. Previous qualitative research among bereaved reported feelings of impotence, of desolation, of derealization, and as well as lack of support and lack of helpful rituals. Presumably, these circumstances affected their processes of separation and taking leave of their mourning and grief. Therefore, we aimed at studying and answering these questions. How have relatives been doing with their grief after the loss of a beloved one during the COVID-19 pandemic? Which needs for support have they received or would they have desired to receive? Second, how did they perceive the care and support their dying relatives got in hospitals, in other institutions like nursing homes, or in home care? Third, how did they themselves feel accompanied and supported themselves? Which topics were addressed when talking with clinical or pastoral staff? And what kind of further support did they hope for? What did we do to answer these questions? We used a mixed methods design. The study is still going on. And the online survey had a first phase in which we took for a first sort of evaluation. We report the sampling period from mid-July to mid-November in 2021. The ongoing phase is going to be analyzed probably in summer this year. We used different elements in a standardized questionnaire, and we got the approval of the University Witten-Herdecke Ethics Commission. The survey was done also with, well, how did we get to, well, to the mourning and grieving people? This is a real difficulty. This is a difficulty with obstacles which we cannot overcome in the sense of getting a representative picture of grieving people, because you need to know who has lost somebody and can we approach them, how could we approach them. Therefore we asked pastoral care workers, others who, spiritual care workers, and other institutions who deal with either burials or with pastoral work. And it's certainly therefore that we have a skew in our sampling, that it is not a representative sample but a convenient sampling, which to which I will make a further comment a bit later on. When you here you see that we had 85 respondents within 4 months. This is not very much. It was an online survey. We had many more who had a first look into the survey, and we had among these many more, we had a big group of those who started and then stopped. That means the questions which touch mourning, grieving, taking a leave, let go, and so on, are not easy. This is why we also ask for the Ethics Commission's opinion if we can do this. And the sort of the strategy to ask people to participate via a mediating person like a pastoral counselor or a spiritual care person was also sort of the trick, that they could easily return to that mediating person and ask for support if needed. So these are the participants who went all through, who made the whole survey, and we got 85 persons who we are very grateful to, that they gave us their subjective answers. You see the skew as to the Catholic denomination. We have a majority of Catholics who participated, but not only. We had a big group of relatives of people who died in the hospital, and about the other half was either in the nursing home or at home. In the case that people died on the site, in 2/3 of the cases there was the possibility to visit the site and the person they lost, and many of them also had contact with their relatives on site. As to the results of our questions, we can say that people who reported a weak burden of their grief also reported a relatively low need for support. We see that with the increase of the burden of grief, there's an increasing need for psychological support, and even more strongly a need for pastoral care expressed by the respondents. If we then differentiate between people who lost a person at home or lost a person in a hospital or in a nursing home, we have a mixed picture, and we see especially that there is quite a high quality of support they guessed for their dying relatives by the caring team on the right side, both at home and in the institutions. You see most of them express a positive opinion, while we have a very high column of indifference, saying that people don't know how the care was for their relative in the nursing home or in the hospital, how their dying relatives were taken care of. Our third result is about the quality of support which the caring team gave for the bereaved or mourning people. Here again, we differentiate regarding the institutions and the situation at home. And here you see that those who had a casualty at home were rather positive about the care they received, and we have a relatively high number with regarding the care received from a hospital or nursing home team. If we include the indifference columns, which usually avoid a negative tendency or negative answer, we see this is quite a considerably high percentage of people who could not get any care by or were not satisfied with the support they got from institutional teams. Which topics were addressed by the caring teams when they talked with the bereaved about their situation? On the left side, with the blue columns, you see that they addressed the farewell and the sadness, and they addressed organizational questions, and to some extent also the dying process of their beloved one. These are topics that were talked about. And for all the groups, there had been hardly any talk about information on pastoral care, questions or support, or there were hardly any religious questions addressed. Many said there was no time, and very few say they did not want it, the bereaved, that they would not have wanted any support. To the contrary, when we asked our group, our respondents, what they wished, all of them had a high wish for pastoral support as well as psychological support, with some higher values, almost approaching 70% for pastoral care. In the conclusion, these first results from our survey show a pronounced need for psychological and pastoral care and for support in the mourning process, especially under the additionally burdening conditions of the corona pandemic. They also point out that there is a lack of available pastoral care workers, of psychological support, and of low threshold references by the caring staff of the facilities in the sense of spiritual care in these first phases of pandemic-related restrictions. Our study continues. Collaborations with Brazil and Iran have been initiated. Maybe you have an idea or a desire to join us too. It could be helpful, especially doing more justice to all the bereaved persons and not leaving them alone. The qualitative analysis of our mixed methods design, the qualitative analysis of the interviews is work in progress. I cannot report on that yet. Therefore, again, thank you very much, and I'm looking forward to our discussion. Gerne. The question is how we do compare the respondents which might respond now as corona is getting less or even disappearing. I don't think it's disappearing for long. And we ask in our survey, we ask people to participate who suffered from such a loss starting from March 2020. It can be also in, and it was intended under the restrictions. It would be interesting because we can see when we have data on when the death happened, and then we can discern or differentiate as if it's different in different phases, yes. And if there is an improvement now, we could hope so, but yes, yes, sure, sure. Okay, thank you. Good question.